Hi, we're going to make a video with Dysport injections. It's been a while since I've done a Botox or Dysport video because most of the time it's a very simple procedure. But that simplicity still doesn't mean that there's no nuances involved. You've seen me make a lot of filler videos, much advanced techniques when it comes to teardrops, non-surgical rhinoplasty, a variety of other stuff. For example, Botox for gummy smiles, Botox for other issues. Forehead Botox, forehead Dysport, Glabella Dysport and Botox. It seems to be a simple procedure. Millions of people get it, thousands of doctors offer it, but there's definitely nuances in it. You can't treat everybody the exact same way. You have to look at their anatomy. You have to look at what they want, what their goals are, what their pre-existing condition is. So we have a beautiful young patient who is here really for maintenance, but she still has goals. For example, being part Asian, you would think that as an Asian patient, their goals are a little bit different than a Middle Eastern patient, than a Latina patient, and there are. But aside from race, aside from sex, aside from age, every person has different goals. So for her, she wants to have a little bit of a brow lift, but not too much. She wants to have a smoother forehead. She wants to have very little movement. She wants to have less crow's feet, less bunny lines, and we're going to address those issues. So if you move up, we'll have her make some expressions and we'll take a look at that. So come on closer a little bit. So let's make some frown lines. So the frown line is created by the corrugator muscle that goes in an upward fashion over here. Now relax the frown line. Again, you can see the frown line creates this line. Even at rest, you can see that there is a little bit of a depression right there. So the lines have already started forming. Botox or Dysport cannot get rid of those that have already formed. She needs a little bit of filler, microneedling, laser, something in addition. But by doing Botox or Dysport, you're going to prevent that from getting deeper. Now, if she wants an arch, you can lift the eyebrow up a little bit. If you want it to be flatter, you're going to prevent that from happening. But this really depends on how strong her frontalis muscle is. So raise your eyebrows for me. And you can see the frontalis raises across. She's not forming a ton of lines up here. Some people form a lot of lines up here. The beauty of her is it lifts, but it doesn't form a lot of lines. So I don't need to necessarily smoothen the forehead. I can allow it to come up a little bit. But for somebody who forms a lot of lines, if they want the lines smoother, I cannot let the eyebrow come up. Because as the eyebrow comes up, the muscle kicks in, the muscle engages, well, the lines are going to be smoother, but it can't lift. So you have to choose between lift or smooth. With her, we can do a little compromise. Now let me see you smile really big. Big, big, big smile. Crow's feet forms there. You can smooth it out, but even with perfect relaxation of this muscle, as the cheek pushes up when you smile, you may still see some lines there. Lastly, let's look at the bunny lines. When you see bunny lines, smile really big, and you can see these lines that form right there called bunny lines. Again, you can smooth out this muscle, the nasalis muscle, and improve it, but be careful of the large vessels that are running next to there. So I'm going to demonstrate the technique a little bit with Dysport today. So we're going to do Dysport. I'm using 80 units to the glabella and the forehead. I'm going to start with the procerus muscle and go into the depressors. I'm going to go to the medial corrugator, go into the lateral corrugator, doing the other side, medial corrugator, lateral corrugator. Now, you got a bleeder, just hold a little pressure. If I want her to arch a lot, I'm going to leave this completely alone. But then sometimes you may get this spot guy. So I'm going to do a little compromise approach, and I'll show you in a second. We're going to go to the frontalis, a little bit to the midline. I want most of the forehead alone out here, so I'm not doing anything out to this part of the forehead. We're going to go to the upper central forehead, getting the frontalis. Now, if she formed a lot of lines up to the hairline, I'd be placing some in the hairline as well. But she doesn't, so she doesn't need it there. That's why everybody's different. Sometimes as you smoothen this out, the line transfers farther and further back, especially with men with higher hairlines. Again, you got to have this conversation and know what the limitations are. Now, I want her to lift a little bit, but not get significant lines. So I'm going to put a very small drop right there. A very small drop right there. I'm going to come up a little bit higher. Give her a smoother forehead. Then I'm going to go back and finish up with the corrugators. I'm going to grab the corrugator, grab the corrugator, and you can see the direction of my injection. It's towards the corrugator, which is up high. So that was 80 units of Dysport, which correlates to roughly about 25 units or so of Botox. No bruises. Bleeding will stop with a little bit of pressure. We're going to go to the crow's feet and the bunny lines next. So crow's feet. Crow's feet is the orbicularis oculi muscle. It's a circular muscle. We're going to get the lateral aspect. It's a very superficial injection. You can see the needle right there. That's where you're injecting. You're going to create a little blood. You're not going to go deep. To get a lift, I'm lifting the eyebrow up, under the tail, going down here, I'm also going to get the lower lid a little bit. Do a very small drop. I'm going to go to the nasalis a little bit, the bunny lines. You can see the bleb right there. That's where it is. We go to the other side. Stop it. Okay, other side. Little bleb. Lift the eyebrow. Go under it. Bottom part of the crow's feet. Lower lid. And we're going to go to the nasalis. We got a low drop. We go back to Proceris. If you have a little bit left over, finish up there. And that's it. So essentially that's it. And you saw on this patient, that's the pattern of the Dysport injection. Some patients, I want their cheeks to elevate more, so I'll skip the bottom 2 doses of the crow's feet. Some patients, if they have tear troughs, I don't want to inject the lower lid. I want that area to crimple up a little bit, cover up the tear trough until we correct the tear trough. So there's a lot of little nuances that goes into it. Not everybody gets the exact same injection pattern. I can inject somebody 7, 8 different ways. And sometimes you have to play around with it. You do the injection, have them take some selfies, have some videos in a couple of weeks, because they'll forget 3, 4 months later when they come back and they say, well, I wish it was like this. You're not going to remember what exactly the issue was. So as they take selfies or take some videos or have them come back in and see you in a couple of weeks, then you can fine tune it and adjust it, do a little higher dose, lower dose, different pattern, different ways. That's the beauty of Botox and Dysport. Even a simple thing such as Dysport injections, there's lots of different variations to it. Thank you so much.